Could we step in earlier and limit the nerve damage that follows an MS flare? I'm Dr. David Haase at the MaxWell Clinic, and over the next few minutes, I want to walk you through how habitat optimizing plasma exchange, what we call H.O.P.E, paired with the Wahls Protocol, may help when high-dose steroids alone can't keep up. My goal is to give you, your family, and your clinicians practical information you can act on today. So, why does nerve damage keep adding up after an MS flare? Multiple sclerosis is an immune challenge. The body attacks the myelin insulation around nerves, and even after a relapse appears to calm down, the bloodstream can still be loaded with rogue antibodies, complement fragments, cytokines, and bits of damaged myelin. Those molecules work like embers after a forest fire, still hot, still capable of reigniting the flames. Over weeks and months, they lay down scar tissue, slow electrical signals, and chip away at vision, balance, and cognition. The longer these inflammatory triggers linger, the more difficult it becomes for the nervous system to repair itself. Let's talk about steroids. If they are the go-to treatment, where do they fall short? High-dose intravenous steroids, such as methylprednisone, have been frontline rescue therapy for decades because they can shorten recovery time. But roughly 1 out of every 3 patients either gets limited benefit or struggles with really severe side effects: crushing fatigue, mood swings, blood sugar spikes, insomnia, long-term bone loss, and increased infection risk. Perhaps most important, steroids quiet inflammation, yet they leave the embers, the circulating antibodies and debris, untouched. Patients often tell me, "I felt better for a few weeks, but then it was as if the disease caught up again." So what exactly is plasma exchange, and how can it help? Therapeutic plasma exchange removes the liquid part of your blood, the plasma. By doing so, it filters out these damaging molecules, and it returns a clean replacement solution back to the patient. Think of it as changing the oil in a car that's been running on sludge. Fresh oil allows the engine to run cooler and more efficient and last longer. The American Academy of Neurology recommends plasma exchange for severe relapses that don't respond to steroids, and multiple studies show meaningful improvements in disability scores, vision, and limb strength within weeks. Complication rates are low, some lightheadedness, occasional low blood pressure episodes, and rarely infections at the catheter site. At MaxWell Clinic, we perform an advanced form of plasma exchange. Typical plasma exchange is purely subtractive. It focuses on what comes out of your blood. H.O.P.E is both subtractive and additive. Let me tell you how our H.O.P.E approach improves on standard plasma exchange. First of all, we have customized replacement fluid. We enrich the fluid that goes back in with optimal levels of albumin, electrolytes, trace minerals, antioxidant cofactors to nourish your cells, rather than merely just filling space. We have multiple session series. We typically schedule 6 exchanges over 2 to 3 weeks. That cadence keeps inflammatory triggers low while giving your innate repair process room to breathe. We do data-driven tracking. From blood biomarkers to functional tests like CNS vital signs, we measure before, during, and after treatment, so improvements are not just felt, they're documented. It's important to remember, the cleaner and more optimized your cellular habitat, which is your plasma, the younger the stem cells in your body behave. If your plasma is full of toxic factors, your stem cells behave as if they're old, limiting their ability to regenerate tissues effectively. By cleaning the plasma and introducing healthier components, we create an environment where stem cells can act younger, leading to more robust healing and overall vitality. Perhaps you've also heard of the Wahls Protocol. Let's talk about that because it's a great addition to habitat optimizing plasma exchange. The Wahls Protocol, created by my friend and colleague Dr. Terry Wahls, who reversed her own advanced multiple sclerosis, is more than just a diet. It's a lifestyle blueprint for immune and mitochondrial health. The main features are 9 cups of produce a day, 3 cups of leafy greens for magnesium and folate, 3 cups of sulfur-rich veggies like cabbage and onions to support detox pathways, and 3 cups of deeply colored fruits and vegetables for antioxidant polyphenols. Quality proteins and healthy fats, grass-fed meats, wild-caught fish, and organ meats provide omega-3s and B vitamins crucial for myelin production. And strategic movement. From simple daily walking to electrical stimulation, exercise recruits underutilized muscles and helps rewire neural circuits. Randomized trials show the Wahls food plan reduces fatigue by as much as 30%, improves mental clarity, and supports emotional well-being without increasing relapse rates. By lowering oxidative stress and feeding the mitochondria, it dovetails beautifully with habitat optimizing plasma exchange's goal of creating a regenerative internal environment. You may be wondering, could H.O.P.E be right for me or my loved ones? I would say consider H.O.P.E if you have an acute relapse that remains stubborn after high-dose steroids. If you have relapsing remitting or active secondary progressive MS with ongoing inflammatory activity on an MRI, or if you have a desire to reduce the cumulative steroid exposure because of brittle bones, diabetes, or mood disorders. Here's a few common questions with regard to H.O.P.E for MS. So, will I still need my disease-modifying therapy? Yes, for the time being. H.O.P.E is a powerful adjunctive treatment, but not a standalone cure. What are the risks? Well, temporary lightheadedness, mild anemia, or low blood pressure occur in a minority of patients and are usually managed on site. Serious reactions, such as severe infection or bleeding, are very uncommon, less than 1% in our experience. Can your local neurologist stay involved? Absolutely. We're happy to provide detailed treatment summaries. So here are some of the next steps for you. If you're curious about whether H.O.P.E could help you or someone you care about, schedule a virtual H.O.P.E consultation with one of our clinicians. We'll review your situation, answer preliminary questions, and outline next steps. Call or text 615-370-0091 to get started. No one with MS should feel condemned to watch the disease march on unchecked. By combining habitat-optimizing plasma exchange with the nutrient-rich Wahls Protocol and a compassionate integrative care team, we aim to help you reclaim function and hope faster than you may have imagined possible. By combining habitat-optimizing plasma exchange with the nutrient-rich Wahls Protocol and a compassionate integrative care team, we aim to help you reclaim function and hope faster than you may have imagined possible. Remember, your nervous system is designed to heal. Sometimes it just needs the right habitat, and that's exactly what H.O.P.E provides.